Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 138,803 confirmed cases of COVID-19 in Canada and 45,068 cases in Ontario. Chatham-Kent has 366 cases and Sarnia-Lambton has reported 343 cases. Michigan now has 113,183 cases, with 14,078 cases being in Detroit. Today, we are reporting 2,608 cases of COVID-19, an increase of 9 cases from yesterday. 1 is a worker in the agri-farm sector, 1 is travel-related, 2 are community-acquired, 4 are close contacts of a confirmed case, and 1 is still being investigated. 2,440 people are now resolved, and 92 people are active and being followed by our health unit. 1 person is in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are 3 retirement homes currently experiencing a COVID-19 outbreak. With return to school, parents are reminded to conduct daily symptom checks before sending their child to school. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Please check our website for information for parents and caregivers as children return to school. We have prepared guidance for both elementary and high school students, including a quick symptom checklist to help you determine if your child should remain home due to illness. Our nurses are working closely with the schools to support the safe return back to school. Each school has an assigned nurse who is the primary contact for COVID-related issues. The nurse works with the school principal to provide direction and next steps upon the notification of a case in the school, including sending students home as required, specifically the cohort, facilitating communication with the parents and guardians and answering any questions is also a role of the nurse in conjunction with the school principal. Yesterday, we had 2 nurses on site to answer questions and work with the principal. Back at the health unit, our staff of case and contact management nurses will then follow up with any identified students and provide direction regarding self-isolation, testing, and return to school. We also work closely with the assessment centers and alert them to any possible increase in people attending the centers. Parents are being asked to attend the St. Clair College Sportsplex for testing if needed. Other testing centers include Windsor Regional Hospital, Olette Campus, Erie Shores Healthcare in Leamington, and SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to quick access online, you may receive your results before the health unit contacts you. Please continue to visit our website at wechu.org for the most current information on schools and workplaces. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Building up of what Teresa has noted, as more people return to businesses and schools, we have seen and will continue to see an increase in our daily cases. The cases reported yesterday reinforces the message that we have been sharing for many weeks and months. The importance of thorough and detailed plans that adhere to health and safety guidance for COVID-19. For families with children, they must plan for their child, how to screen your child, how to educate them on their safety in school, and what to do if their cohort is dismissed. A well thought out plan and strict adherence to them not only minimizes the potential transmission of COVID-19, but also put schools, businesses, and other workplaces in a good position to act quickly in response to any potential exposure and limit the spread of the disease. The Windsor-Essex County Health Unit provides a detailed toolkit for businesses and schools related to reopening, as well as provide regular feedback and guidance from receiving calls, reviewing and providing feedback on plans, and responding to the questions coming from the community. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from the Windsor Star?
Yes. Good morning, Dr. Ahmed. So I know you're talking specifically about the case reported among a Catholic school yesterday. How did everything go in dealing with that very first case?
So I'll start, but maybe I'll just pass it on to Teresa to comment. So I think it went very well. We were notified of the case. We worked with the school boards to put all those systems in place that we already talked about. Our nurses were on site, but I'll let Teresa maybe just add more details to what specific action that we have taken. And that's what the importance of having a good plan in place. So over to Teresa.
I agree. It went well. We've been communicating for some time now with all the school boards and do have plans in place and have weekly meetings with them as well. So having the nurses assigned to the school has worked out very well from our end because each nurse has a complement of schools, and so the communication between the principal and the school nurse occurred as we had hoped. And then at the health unit, we have the case and contact management nurses that are dealing specifically with the cases, and now they'll deal with high-risk contacts. So the communication, coordination, and working with the school boards, the principal in particular, worked out very well. Our nurses did attend the school on site yesterday, 2 of the nurses, and they are the nurses assigned to the school. So they said it went well. The principal did a great job. It went well as it can be expected. There was communication to the parents, so our nurses will be connecting with the parents today of the cohort that was dismissed and answer any further questions and kind of reaffirm next steps, what they're to do regarding testing and return to school and that kind of process. So it did go well, and thanks to good plans and good communication.
And I don't know if you're able to share this information, but was the child symptomatic when they were in the classroom?
Is it still? We don't typically share that information, but the child was not symptomatic.
Thank you.
Any questions from Windsorite?
Not at the moment, thanks.
Any questions from CBC?
No, thank you.
Any questions from AM 800?
Dr. Ahmed, for the cohort, and correct me if I'm wrong here, but it's just the students in that class that will have to self-isolate now for 14 days. But isn't that student, or if that student does go on a bus, they're in contact with the other kids on the bus. If they have siblings in other classrooms, that they're in contact with their siblings and their siblings go to another classroom. Are you worried this could spread? Just assuming it could, and others should be self-isolating as well?
So reiterating some of the same message about the planning piece, that why it's important to have all those plans. And so we did took into consideration everything that you've mentioned and tried to identify any potential risk to anyone outside of that case and to that classroom. We did take all of that into consideration, and based on our investigation, we provided all those guidance accordingly. We don't think that the child took the school bus. So there is no reason for anyone to be concerned about the school bus and the exposure. The child was privately picked up and dropped, so it didn't pose any risk and dangers to anyone else who shared the same bus space. As far as the siblings, are concerned, if there are any siblings, they are asked or they are to exclude from work because they were the high-risk contact of the case, and themselves, just being sibling doesn't necessarily make them a case. And so as a result, anyone who is part of the class of that sibling is not at risk. And so we are closely monitoring the situation, and we're hoping that with all those good measures in place, there should not be any transmission in the school board. But those are some of the things that we still have to figure out and see to feel more confident with respect to some of the measures that are currently in place. And that's why the cohort is dismissed, to prevent any further transmission, if at all, if it happens. And for the families of the children of the cohort that is dismissed, they don't necessarily have to self-isolate at this time. The child has to be self-isolated with the rest of the family member and monitored for their symptoms to make sure that they do not develop any symptoms. There have also been provided direction with respect to testing, and our nurses, as Teresa mentioned, will be connecting with the families to provide more specific guidance and answer any questions if they have.
Since June, when the social circles were introduced, yourself, the province, other health units, and most recently you've talked about sticking with those social circles. But with everything opening up now, kids, adults seeing other people either at their place of employment or at schools. I know arenas are opening up; they're pretty booked. So hockey teams are getting together, figure skaters are getting together. Is it time to, and I hate to say it, but eliminate the social circles because everyone's interacting with other people that are not within their social circles?
Well, Rob, that's a good question, and I think it's a fine balance. So as we always talked about, when we are dealing with this pandemic, so yes, we definitely are more concerned about the spread and transmission of the disease in the community, but we also recognize some of the social and economic aspects of our well-being, because that's also part of our overall health. And when we are thinking about the need for connectedness, the need for people to socialize with others, it's also very important. The concept of social bubble and the gathering and maybe loosening some of those restrictions are designed to provide that level of comfort and access to people, to your social circle, to meet that need. But what we are seeing is people maybe not necessarily following all the recommendations and all the directions that we are providing them with respect to social circles or social bubbles. And I think that's the critical piece. So it's having a social bubble concept, it's not necessarily a bad idea, but I think having a clear understanding of how you use that, it is very critical. And by default, I think it's easier to say that anyone who doesn't live in your household, you try your best always to maintain your physical distancing. And I think maybe even just using that analogy, and because practically you cannot count how many people that you can come in close physical contact with, you should not, ideally, anyone who's outside of your home, ideally you should not get in close contact with any of them. But if you are meeting people, if you are socializing, my recommendation always would be to maintain physical distancing, and if physical distancing cannot be maintained, use facial covering or face masks to further keep yourself to further protect everyone around you. So I think that's the message, but it's something that I think people need to wrap their head around and clearly understand that concept.
Thank you.
Any questions from Blackburn?
Yes, good morning. So I know you said your nurses are answering all of these questions, but just for parents who are wondering what would happen if their student's cohort got sent home, what are you telling them? Do they all need to get tested? Should they be waiting a time period? What advice are you giving the parents of the children in this cohort?
So when the parents were asked to pick up their children, the schools had prepared a letter, and this letter was in conjunction with the health unit, and it provided guidance as to next steps. So high-risk contacts would be asked to self-isolate for 14 days, and this is in the letter. And the direction is to get testing after day 5 of the exposure. Or it's recommended. It's not mandatory, but to recommended to get testing after day 5, or if symptoms develop in the child, then to get testing right away. And there is also a return to school date after day 14, and a letter goes to the school actually alerting them as well as to when they can return. So as our nurses talk to each of the parents today of the children that were dismissed, they'll be able to answer any further questions, but it was very specifically outlined in the information that was sent home with the parents at the time they had to pick up their children.
And this would be the same protocol followed for any cohort that needed to be sent home at any school throughout the year?
Well, this was deemed, this is with a case, so it depends what the situation is. Every situation will be a little bit different, but based on this interaction, this case, that this is the recommendation for a high-risk cohort, so it would be in the classroom. And as Dr. Ahmed said, had there been a bus transportation, that would have been another cohort, but it would have been similar guidance for that as well.
Okay, thank you.
Any questions from CTV?
Yes, good morning, Dr. Ahmed. Good morning, Teresa. Just curious, was there an age for this student? Older, younger?
We're just saying that the child is in elementary school, but we're not giving out the age. We're trying to protect the privacy and the personal information of the child, so we're not releasing that.
Okay, and you were talking about nurses earlier. So each school is assigned with a nurse. I know that you guys were there yesterday. So how many nurses took care of this school out in Amherstburg?
So we have, through the Ministry of Health and the government, we did receive funding for 19 nurses, 100% funding through the government specifically for school-focused nurses to support COVID in the schools. And so we have 20 nurses assigned specifically across 163 schools. So it's not 1 per 1, but so in this case yesterday, one of our nurses that is assigned to that school, she attended with another nurse that is actually working with her at this time. So both of them went out, and the cohort that was released was one class. So it wasn't the whole school or anything like that. If that was the case, we'd be redeploying many, many people. But so one, 2 nurses attended on site yesterday, and then we have 20 nurses at our health unit as well. They're not at our health unit, they're working remotely from home to do the case and contact management follow-up on the phone. So we have nurses assigned to that specific work as well.
Okay. Just wondering too, was the teacher quarantined as well, or is that teacher in school today? Like, is that a suggestion you would make for that person to stay home, or would you allow them to go back to school?
So with the teacher, our nurses would be doing interviews with any teacher that was in the classroom, and based on that interview, they would determine if it was a high-risk contact or not. And if the case is not the case, if the teacher is not deemed to be a high-risk contact, they would be asked to self-monitor for 14 days and could continue to attend school. But all of the investigations are going on, and the teacher may have to be self-isolating if deemed that there was it was necessary. But the other option is the self-monitoring if there was not deemed a high-risk interaction.
Oh, so that's something that you haven't suggested yet then, right? Is that something the school board has to determine, or?
No, our nurse will work directly with the teacher and determine, the exposure, the practices that were in place. Teachers are wearing masks, they're maintaining their physical distancing. So it's going through all of the, the logistics of what the day looked like and, the interactions with the teacher and the students.
Okay, and then lastly, sorry, I hate to bombard you with so many, but I was over at the school today, and I know overall the parents are really happy and satisfied with the way the protocols were rolled out. They all received phone calls and whatnot, but I did speak with some parents who were kind of apprehensive about allowing their kids back to school today. So what would you say to them to kind of alleviate their anxiety?
I would say that the plans that were in place have worked. The notifications work. Parents are often, because of the online access to testing, they may know before even the school knows, as long as they're communicating with their school and the health unit's communicating with both the parents and the schools, all of the communication, the plans that are in place, the protective measures that are in place, all have worked out well. The schools are prepared, the principal in particular. In this case, it's our first case, but he was well prepared and had everything ready. As I said before, we've been meeting with the school boards. We've all taken it very seriously, and the plans that we have in place worked for this particular incident, and it's all that good preparation. So the parents can go back to, be reassured that everything that we have put in place has worked well, and the students that are being, that have been dismissed, they're at home where they should be, and for their protection. So everything did work out well, and we do attribute it to the good planning and the preparation of the schools, the school boards, and the principals have a very big role in this as well, and the teachers. So everyone did come together, and our nurses for sure.
So I sense a little confidence heading forward. Just, I'm sure it could happen again, and I'm sure there's a little more sense of security on your part, knowing that the first case rolled out okay.
Well, yes, we're happy that yesterday went smoothly, but it's not over yet, because the cases that or the students that have returned home that are dismissed, they have been dismissed for a reason. They are deemed a high-risk contact, so it is very important that they monitor for symptoms and get testing if symptoms develop. All of these practices are to prevent further transmission in the schools. So while yesterday went well, we still have to make sure that we're trying to reduce any further transmission. So the true success will be to try to make sure that has occurred. So it's too early to tell, but with all these good practices in place, we feel that we did the best we could with the information, and everything was very timely and worked out very well.
Great, thanks, Teresa.
Any questions from iPolitics?
Hi, yeah, good morning, everybody. So as case counts rise in certain areas in the province, the Premier has said that if local medical officers of health would like to reintroduce some restrictions for businesses, including those that operate indoor dining or other kinds of indoor gatherings, that they have the authority to do so under the Health Protection and Promotion Act. And so do you agree with the Premier?
Well, I think we took the unusual step even before the province started imposing their restriction, and it started right from the St. Patrick's Day in Windsor-Essex, and then I think within a day or two, the Premier and the province and now made that announcement. So we do feel that if it's necessary to protect the health and well-being of my community, we may take that step. But we definitely don't want to take that step, and I think that's the critical piece that we like everyone to be aware of, is as the Premier mentioned, the fate of our second wave and our community is in our hands, and how we move forward will determine how much an impact the second wave would have in our communities. So we have to recognize that all of us are in this together. And the residents, the businesses, everyone have to do their part to prevent us from getting to that stage to even start contemplating those ideas. We understand that the health and well-being, reducing hospitalization, mortality is critically important, but it's also important to have a good economic and social well-being of our community. So we want to find that right balance, and the right balance can only be achieved if we all follow the recommendations and guidance from public health that we have been doing so for a number of months now. We just need to keep it going and keep our community safe.
And do you think that medical officers of health in the province will be hesitant to act independently from the province if there's no, direction coming straight down from them?
I don't think so. I think all of us in our capacity, we do have a job and responsibility to our community. And if we feel that there is a risk to our community, many have taken a number of different steps based on their unique situations, on their unique epidemiology of their own region. So I don't think that they will be hesitant or reluctant to do so. It makes it a lot easier if any kind of laws or guidance coming from the province. It gets additional support, it gets additional, resources to implement that, enforce it in so many different ways. So we do appreciate anything if it's coming down from the province with the understanding and discussion with the local public health unit, because all of us have different demographics, different epidemiology, different challenges. My region has a high number of agricultural farms. No other regions have that many farms. So our situation is very different. We've got a good mix of urban and rural communities. Others may have either just rural communities, just urban communities. So I think we do need to take all of that into consideration. So a blanket statement from the Premier, sometimes it can be challenging for some region, but it also provides a more level playing field across the region. So I think really depends on the situation. If it's a clear-cut, straightforward decision, and if it's implemented by the province, it's much easier for us in so many ways. But if there are something specific that we want to address locally, we do have that ability, and I think none of the medical officers of health will hesitate to use that.
And if I could just one quick follow-up there. So, if we do see more explosive growth in this second wave, would you prefer for the province to take the lead on reintroducing restrictions and provide that guidance versus for them to say to the medical officers of health, if you, based on your local situation, make decisions that you will?
Yeah, so that's a good question. And as I said, there's always pros and cons of both approach. We always get in touch with the Office of the Chief Medical Officers of Health and the province. And we share our epidemiological summaries. We share updates, any unusual or cases, number of cases, clusters, workplaces, businesses, anything unusual that happens in our region, we do communicate it back to the province. And if the issue is very localized just for us, I think it would make sense for us to do something. But if it's a widespread issue, it's a broader issue that can be enforced by the province, then they can do it. But I think the dialogue is necessary, and sometimes to understand the context. What the Premier can see based on the information that they are seeing, that they are getting, the numbers, and if they make a decision which would make a different meaning, or if it has a different meaning for us locally, knowing our local situation, and then it's a different between us and them. So I think we have to work together, and any decision that comes together, I would say that if it's a joint decision, joint recommendation, it carries more value, more weight, and it's much easier to implement, enforce. So we'd be looking forward to that rather than any unilateral decision either by the local medical officer of health or either by the province themselves. So I think if a joint decision can be made and a joint implementation enforcement, that would be the ideal situation.
Okay, thank you so much, Dr. Ahmed.
Any additional questions from the Windsor Star?
No, thank you.
Any additional questions from Windsorite?
No, thanks.
Any additional questions from CBC?
No, thank you.
Any additional questions from AIM 800?
Dr. Ahmed, tomorrow you'll be providing us an update on the second cluster. Can you say if this student is a part of this cluster?
Not at this point. I cannot comment. I don't think so, but I cannot comment further. We'll have to look at the details.
Any additional questions from Blackburn? Oh, sorry, go ahead, Rob.
One more, sorry.
Sorry.
I'm not sure if I missed this, but Dr. Ahmed, was the student exposed to the virus at the school? Will you be sharing that information, or you'll just be saying a student has the virus?
So we won't share all those details with the public unless we feel that there is a transmission. So what I can say is that the transmission didn't happen in the school to our knowledge, but as the other rest of the cohorts are identified, we hope that that continues. To our information, the case acquired the disease outside of the school environment, but we hope that there is no further transmission happening at the health unit. But again, a lot of that is based on our investigation. Our investigation didn't reveal any potential source of acquisition at the school environment.
Okay, have a good day.
Any additional questions from Blackburn?
No, thank you.
Any additional questions from CTV?
No, I'm good. Thank you. Have a good day.
Any additional questions from iPolitics?
Already left.
I'm gonna take that as a no. Thank you, everyone.
Thank you.
Bye.